The first one is, of course, to eat better. So eating a healthier diet. There are many healthy diets that are recommended as part of this, I guess, recommendation. There's the Mediterranean style eating pattern, which I'm sure you're familiar with. We have the dietary approaches to stop hypertension, the DASH diet, which is actually they're all overlapping in that they all emphasize plant-based foods. So fruits, vegetables, legumes, whole grains, lean proteins, fish, healthy oils, limiting processed foods and sugar, and sodium, of course. The second one is staying physically active. So again, physical activity. So it's 150 minutes per week, so 2.5 hours approximately of moderate to vigorous physical activity. If someone is doing vigorous physical activity, it's like 75 minutes is the recommendation. For context, moderate physical activity is, for example, brisk walking or dancing, whereas vigorous is more something like running and swimming. The third one is, of course, not smoking or avoiding nicotine. I should say now, not just not smoking cigarettes, but also this refers to vaping and also secondhand smoking. So just avoiding all of that altogether.
And is vaping a risk for heart health?
Yes. So the literature on that is obviously not as extensive as cigarette smoking, just because vaping is a newer phenomenon, I should say. But in general, the recommendation is not just for cigarettes and cigars and pipes, it's also for vaping products as well. The fourth one, my favorite one, is the sleep health one. And this is the newest metric that was added. And then the other four are all health factors. So like we talked about, managing your blood pressure. So keeping your systolic and diastolic blood pressure under 120/80. These are set up that the health behaviors kind of inform the health factors. So to improve the health factors, you have to address the health behaviors, basically.
So if I did the things like eating better and getting more sleep,
Yes.
I can reduce my blood pressure?
Yes, exactly.
Got it.
Of course, if someone is already in the hypertension category, there's also obviously medication use. And the way that kind of you get scored on those metrics considers that as well.
Can medication significantly reduce your risks of heart attacks as
Yes,
a
of
result
course.
of the blood pressure?
Yes, of course. So having blood pressure that is well managed by medications definitely lowers.
So if you're listening to this and you're not being really good about taking your blood pressure medication?
Yes, you should. If someone has hypertension, yes, then they have to see their physician and potentially get pharmaceutical treatments for it as well, beyond just the lifestyle piece. And then the same thing applies for managing blood cholesterol, blood glucose, and of course, the final one is body weight status, which they measure by BMI, so keeping a healthy body weight.
And so those last ones, if I play back, you said blood sugar, blood pressure, but cholesterol and weight. So
Yes.
that those last three, these are again measures that if I see the doctor, they'll judge. So very high blood sugar is diabetes.
Yes, and with blood sugar too, we have to pay attention to prediabetes. You know, with blood sugar, you can either typically you measure your A1C, which is more of a measure of your your longer term blood sugar control over the past 3 months, or you can measure your fasting blood sugar, as many of us do in a routine blood test. You want your fasting sugar to be less than 100, your A1C to be less than 5.7. But we also have to pay attention to prediabetes. It's essentially a fasting blood glucose between 100 and 125. So it's this state that's in between having normal blood sugar, but also you're not in the diabetes range yet. The reason we have to pay attention to this is because it's become increasingly prevalent. Here in the US, the prevalence of prediabetes has become very high. It's almost 38%, 40%, very high. And more than half of those individuals will eventually progress to type 2 diabetes. So a very important high-risk state to intervene at to kind of reverse those trends to avoid progressing to type 2 diabetes.
And this is related to your diet again?
With prediabetes, oftentimes, yes, the first thing to do would be a lifestyle change, yes. So diet, sleep, physical activity.
And then you mentioned high cholesterol and weight.
Yes.
These are similarly factors driven a lot by what you eat. And
yes, for cholesterol, we look at non-HDL cholesterol. For a lot of individuals, that is, of course, influenced by what we eat. It's influenced by our body weight, physical activity levels.
And just one question, Nour. I feel that for a lot of people I know, when they think about their heart health, the cholesterol number is the number that they think about as their heart attack risk. And I can think of a number of people like that. Are they right to feel like that is the direct measure and like the one number that really matters for their heart health?
It's a number that really, really matters, but it's not the only number that matters. let's say someone has normal blood cholesterol. If you have normal blood cholesterol, but you have hypertension, you really have to pay attention to your risk of heart disease because, again, like I said, hypertension is the leading risk factor for heart disease. But there's always a debate, I feel, between scientists who study cholesterol and scientists who study blood pressure about what is more important. And both of them are extremely important, of course, but quantitatively at the population level, the risk factor that leads to the most heart attacks and strokes is blood pressure. So you can't look at your cholesterol without looking for your blood pressure. In the US, we've seen a doubling in the number of people who now have both diabetes and blood pressure. The take-home message from this is that if someone has high blood sugar, they should check their blood pressure to see if that's high too. And similarly, if they have high blood pressure, check your blood sugar, check all of them, because we're seeing an increasingly clustering of those risk factors together.